Hello my nursing friends, how are you? Hope you are doing well. This series we are discussing or learning about the drugs. We have already discussed about noradrenaline, adrenaline, dopamine. If you have not watched my videos, please go and watch. Link will be available in the description box. So today our topic is dobutamine. Dobutamine is a drug which is also very common. We are using in our intensive ICU. So let's start with dobutamine. We'll start with the mode of action. This is a sympathomimetic drug. Dobutamine maximum acts on beta-1 adrenergic blocker receptor. So dobutamine maximum effect is on beta-1 adrenergic receptor. In our previous video, we already learned what is adrenergic receptor. There is two type of receptor, alpha and beta. Okay, so alpha and beta. There is alpha 1, beta alpha 2, beta 1, beta 2, and beta 3. Beta 1 mostly present in the heart. So how it acts when dobutamine your infusion should be started. The beta 1 receptor, there will be increase of myocardial contractility. So there is a positive inotropic agent, and it will also help to increase the heart rate. So it is called positive chronotropic agent effect. So in beta 1 we can see myocardial contractility will be improved, so cardiac output will be more. It will also help to increase the heart rate. So there will be also effect of chronotropic in such cases of dobutamine. Dobutamine also less effect on, very minimal effect on beta 2 and alpha 1. So there will be very mild effect like vasoconstriction and vasodilation, but that is not like the noradrenaline or adrenaline. Okay, let's come to the use in our ICU or medical use. We can say dobutamine is the drug we mostly use in congestive heart failure. So if heart is not pumping properly or adequate blood, if it is unable to pump because of hypertrophy of myocardial muscles, so it will improve the myocardial contractility because it affects on beta-1 adrenergic receptor. So as it helps to improve the myocardial contractility, the pumping effect will be more. So there will be more cardiac output, stroke volume will be increased. Okay, increase stroke volume. Next is cardiogenic shock. So again, in such cases, if shock leads from myocardial contractility, then myocardial muscles will be pumping more. It will affect on myocardial muscles. That's how it will improve or treat the cardiogenic shock. Third is stress testing. If patient is not able to walk, so in such cases for treadmill test, if patient is not able to walk, in such cases we will use very low dose of dobutamine to increase the myocardial contractility, and we will see the changes of ischemic changes in the ECG. Okay, that is how we are doing the echo, that is called dobutamine stress echo. So there is also a pharmacological uses in such cases. And lastly, you can see if low cardiac output syndrome. So if any acute situation arise like post surgical cases, post CABG cases or post MDR cases, if low cardiac outputs, that is not a longer period of, not as chronic cases. So in such cases, we also use the dobutamine to treat acute low cardiac output effect. Let's start the doses. So dobutamine we can start from 2.5 to 5 mcg per kg per minute, and it can be titrate, or it can be goes up to 20 mcg per kg per minute if patient is not hemodynamically stable. Okay, so 1 ampule of dobutamine is equal to 250 mg. We can mix with 9% normal saline or 5% dextrose. So 5 ml dobutamine plus 45 ml NS or dextrose. So there will be 50 ml of mixed drugs of dobutamine, and you can start according to the max calculation or concentration higher dose. So in our next video, we'll learn how to do the max calculation of inotropic effect. So this is the dilution part. 1 ampule is equal to 5 ml. 5 ml is equal to 250 mg. 250 mg should be diluted with the 45 ml of normal saline or 5% dextrose. And you can start with 2.5 to 5 mcg per kg per minute. It goes up to 20 mcg per kg per minute. Next is the contraindication. We'll see what is the contraindication. In any tachyarrhythmia, all the inotropic agent, in case of tachyarrhythmia, there is a contraindication for use. Okay, hypertrophic, obstructive cardiomyopathy. If heart muscles is unable to pump and we are giving dobutamine, in such cases there is a chances of cardiac arrest also. Okay, so last is pulmonary artery hypertension. So in such cases, if pulmonary artery hypertension is there and heart is not pumping properly, so it is also increase the pulmonary artery hypertensions in any other cases. Okay, so if allergy or hypersensitivity of dobutamine, these are the very basic contraindication cases we can see. Now, monitoring. So all the inotropic agent, you should monitor the heart rate and blood pressure, heart rate, blood pressure, and obviously output and ECG changes also. Okay, and if you are administering these drugs through peripheral line, so avoid to do that. Better to transfuse these drugs to the central line only. Avoid peripheral line. Okay, so last conclusion. So conclusion is dobutamine is a sympathomimetic drug. So it is a effect of inotropic and conotropic effect. And what is inotropic effect? That will help to increase the myocardial contractility and it will help to increase the cardiac output. A conotropic effect, it will help to increase the heart rate. Okay, that is the inotropic and conotropic effect. Uses of dobutamine, maximum use we are using cardiogenic shock, congestive heart failure, and in such cases if dobutamine stress echo is required. Okay, so that is the things of overview or very brief overview of dobutamine. I hope you understood the dobutamine, the use and the indication also. If you like my video, please subscribe my channel and give a thumbs up.